Hi, I'm Jim, and I was retired. Now, even though I'm no longer working, I did take a couple weeks of vacation and went to Miami Beach and the Florida Keys. And now I'm back, and this week I've completed lining up our health care plans for 2024. Now, I've been on original Medicare since December 2021, but Marie buys her health care on the Affordable Care Act marketplace. My choices are easy. I renewed my Part D prescription plan. That's all I needed to do this fall. But this week, we completed Marie's enrollment for her ACA plan. So now that that's been done, I've got a measure of where medical inflation is headed in 2024. Now, as I reported in a previous video, I've shopped for my Part D prescription drug plan during the Medicare Annual Enrollment period that runs through December 7. Now, that's something you should do every year since insurers can change premiums, copays, and formularies every year. So I did my shopping on Medicare.gov, and I found that Cigna Value RX remains the best total cost for the drugs that I take, and the monthly premiums will remain about $17 a month. Now, we've also found out that the Medicare Part B premiums will increase about 5.9% from $164.90 to $174.70 in 2024. Now, I should note that that's the base premium. My income from 2 years ago is not high enough to trigger IRMA, or the income-related monthly adjustment amounts. Part B premiums could be as much as $594 a month for those in higher income brackets. I plan to avoid IRMA in my DIY retirement by managing my income. Now, I've also just received the annual notice of premium increase for my Plan N Mutual of Omaha Medigap plan. And it's going to go up about 4% from $124 to $129 a month. Now, keep in mind that the annual enrollment period for Medicare is not for Medigap plans. It's only for Medicare Advantage and the Part D prescription drug plans. You don't shop for your Medigap. You're actually able to change your Medigap insurer at any time during the year, but you'll go through medical underwriting. So it's best to stick with the choice that you make at age 65 in your initial enrollment period. Now, November 1st began the annual enrollment period for the Affordable Care Act. In most states, enrollment will run through December 15th. Here in New Jersey and a few other states, the enrollment period actually runs a little longer. Marie will actually have until December 31st for coverage beginning January 1st, but actually could enroll as late as January 31st for coverage beginning February 1st. Now check with healthcare.gov or your state's marketplace for details. Now, since my wife is about 4 years younger than me, we fell into this catch-22 with one spouse on Medicare and one on ACA. And we found out that costs actually rose in 2022. Now, see that video above for more details. But here's a quick review. Let's begin with just the medical insurance premiums. In this catch-22, caused total premiums to increase. In 2021, we went from $847 for both of us on the ACA to $718 for just Marie. And that's because the advanced premium tax credits are based on household income, but we went from buying insurance for two to only buying for one. And therefore, someone decided that we didn't need as much help. In fact, premium tax credits were cut by about 68%. When you add in my Part B premiums, Medigap premiums, and the Part D prescription drug plan premiums, total premiums reached $1,035 in 2022. Now, I'll note that that 1 month in 2021 was higher because of the way ACA premium tax credits applied for just 1 month. But comparing 2022 to now 2023, total premiums went up more than 7% to $1,112. And when I first looked at the ACA premiums for 2024, it looked like they would go up to 1,174, or 5.6% increase. But that was only assuming that my income wouldn't increase from 2023. When I went back into the 2024 application and projected the income from a slightly higher pension, one of my pensions has a COLA, and a decision to increase retirement withdrawals a bit, so I'll change the total income that I expect in 2024, the premium tax credits changed. And so I now project that we'll spend $1,246 a month in 2024, and that'll be a 12% increase. But that's just an increase in premiums, which I'll admit are based on decisions that we are making about how much income we'll take each year. Now, I don't base withdrawals from my retirement plans on a 4% rule. Instead, I decide how much income I need to take strategically while I continue to wait for 70 for Social Security. The more complete picture on medical costs, though, is to look at premiums plus out-of-pocket expenses. But that's also not based solely on inflation. It's based on real-life things like what kind of medical care you'll actually need. We don't get to choose when to have a tooth extraction or a skin cancer removal or rotator cuff surgery. So when I use data from my Quicken transactions, I can compute an average medical out-of-pockets for 2021, 2022, 2023, and projected 2024 out-of-pockets. Now, based on those numbers, medical costs were flat in 2022, increased about 9% in 2023, and will go up about 3.6% in 2024. Now, while not based on inflation, our personal medical inflation rates were surprisingly close to the Consumer Price Index for urban workers. So medical inflation in retirement will depend on many factors, not just an inflation rate. Some will be based on the decisions you make about the income you'll choose to take and how much of the premium tax credits you expect to take for the ACA plan. It'll also be based on how much the government decides Medicare premiums will go up based on the calculations that they do. And it's also going to be based on what kind of medical care you will need. That will change your out-of-pocket expenses each year. Now, so how do you plan for medical insurance and medical expenses in retirement? The best you can do is use the data that you have and make some wise decisions. Hey, please like and subscribe to this channel if you like entertaining ideas from a DIY retiree. I'm not selling a course. I'm simply sharing my perspectives to help you plan for your own DIY retirement. And I will conclude with my standard warning. I have no initials after my name. So take these as entertaining ideas from one educated consumer to another. Always do your own due diligence and seek out a professional if you need one.